This is Dr. Gossett here with a patient, Alan Woods, who came into Gossett Clinic and Spinal Center of Champaign. Alan, tell us a little bit about the problems that you had and the reason that you came in for care.
Well, Doc, I had went to help my son move in late last February, and we was lifting, and we lifted something heavy over our head, and I felt my back pop.
Okay.
And from that day on, it got worse and worse, and we come back out of Florida, and I got here in Champaign-Urbana, and I called from Florida and made appointments with my doctor in Champaign, and she recommended MRIs, which they've done, and x-rays, and I found out that I had 3 squashed discs and a vertebrae that actually moved out of place. And so she recommended that I go see a pain doctor there at the clinic, and I did that, and he explained that they was going to do a series of 4 or 5 shots to kill the pain that was in my back and down my right leg. And so after I seen him, I told my wife, I said I wasn't doing that because it was just temporary. And I said I'd talked to other people that had these and ended up hurting themselves worse from the pain being gone, and they overdo themselves. So I went back to my doctor and I said that wasn't happening, and I needed another way to go with this. And she says, well, why don't we try therapy? So I did about a 14 visit therapy. Actually, that helped some, very little. In fact, when I ended up coming out of there, I was actually, my leg was in worse shape than when I started. And so then I had some friends in Florida send me a couple pages ads of spinal decompression.
Okay.
And so I started to do some research on that, and I got on the internet and started reading about it, and found out that over in Europe, they do this, they're saying about 70% of the time instead of back surgery, and with a 90% success rate.
Okay.
So my wife and I was sitting talking about it, and all of a sudden your ad came on TV. So I got on the internet and looked you up, and then I thought, well, I'll call and see if he does the decompression, because your ad says spinal clinic. And so I ended up here with you, and when I got here, I hadn't been able to move my neck for 10 years because they said I had disc arthritis in my neck, and I was limited to very little movement to the left or right. I had none to the back and none to the front. Basically, they told me I'd end up with stiff neck. Well, since I've been here, I have back movement to the back. I can tip, I can go frontwards. My side to side is about doubled. I said before I would have to find a position to bend my body to drink a pop out of a can, or use a straw.
Okay.
And now I just bend my head back and get the job done that way, like supposedly is normal.
Right. Very good.
But you know, we went through the decompression. The back is 100% better than what it was.
Your lower back.
The lower back.
Okay.
And I was when I came into you, I was down to walking. If I could get to the car to in the store, that was as far as I was walking. I had to sit down. I was in pain. So as of today now, I'm up to a half a mile, a couple times a day with very little pain, and the pain is actually not the back pain, it's muscles that are, as we've talked, are wrong right now.
Muscles in your low back and hip.
And the hip and the leg mainly. And so that is even going away. And I mean, you have been the best help out there of any place, because everybody else, they didn't want to do surgery. They just want to shoot me up with drugs, and I do not. I'm a person that I like alternative, whether it be drug or this. You know, I'd rather come to do this than be cut on. So.
And you were looking for a long-term fix
Yeah,
versus
I didn't want a short term.
term.
Yeah, everything the doctors were, and I mean, these are nice doctors in this town.
Sure.
They all they want to do, it seemed to me, was a short fix. It wasn't a permanent fix. I asked about being operated on. They said that was out of the question because I am Medicare age, and Medicare wouldn't pick it up unless you went through the song and dance of each little step.
Right.
So they said that was out of the question. You know, I had to go to the pain doctor first and get my shots. Then if that didn't work, then we'd go back and look at it again. And it was just so much trouble for anybody to go through that, and it just seemed like it was a temp fix. Everything was a temp fix, and I'd already put up with this for 7 months. So, you know, coming to you was a godsend.
So you're glad you came? And
oh yes, yeah.
You're happy with your progress?
I'd recommend this place to anybody that's got a bad back.
Well, thank you.
I mean, if your back's hurting, I don't think there's any pain like a back pain.
That's what I've been told.
Yeah, my wife used to make fun of me every once in a while till she hurt hers, and she's never made fun again. Because if you ever have a back pain, you know what it is.
Right, right. So as he came in for treatment originally, it was for lower back related symptoms and with symptoms into pain into his legs. We discovered that he had also peripheral neuropathy, or lack of normal sensation in his feet. We also found that he had degeneration as well as in his lower back in the cervical area, and so he had also, unaware of, he had weakness in some of the muscles and in the sensation in his hands. So he had peripheral neuropathy in his feet and hands that he wasn't even aware of. So he was like a train going down a track 95 miles an hour in the fog and ready to hit 2 or 3 different walls, is what I explained to him. So what we did with him was treat the conditions that he had with decompression and other therapies that were necessary to activate those nerves, to stimulate their healing process, and as a result he has normal sensation now, normal feeling, and he's getting better strength, and we're working through what's left is the muscle tension. And with time, the muscle tension should go down, and he'll continue to be able to be active and probably increase his level of activity. So it's been a pleasure to be your doctor.
Well, it's been a pleasure to be here, Doc.
Thank you.